Good Saturday morning to everybody, and welcome to the Columbia Dental Radio Show. Along with Dr. Mohammadi, I am Gary Byron. This show can be heard each and every Saturday morning at this time. And of course, you can always get in touch for inquiries, even to schedule an appointment at 860-645-0111. Again, it's 860-645-0111. And by the way, I will be repeating that number throughout the show. So if you missed it there, you not only have one other opportunity to get it, I'll repeat it a couple of more times. Doc, good to see you again.
Good to see you.
How was your week?
Good as usual.
I don't even know why I ask you that anymore. It's always rainbows and unicorns in your life. What keeps you busy? How many hours a day do you think you dedicate to your practice?
I work between 12 to 14 hours a day.
Oh, I wasn't expecting that. I mean, is that all at one of your locations, or even when you're home, you're doing some kind of work?
Well, if you want to count when I get home, then it's going to be more than that. Yes, always I receive phone call, even at my home. You know, things happen. Assistant call, front desk call, they are sick, they always manager or myself, or they inform me about ahead of the time, so we need to be prepared. So this is basically a 24/7.
Speaking of 24/7, you guys are open 7 days a week.
Correct.
But you're not open 24 hours a day. So what would happen if it was I don't know, it was midnight or 1 o'clock in the morning, and somebody, they didn't just have a little toothache, they could wait a few hours and come in. Let's say it was excruciating pain. Are there dental offices that are open 24/7? You once were during COVID. I think your Manchester location was. Obviously, it's not anymore. We're out of COVID. Well,
correct. During the COVID, we did that, but obviously, it's not very practical, and from financial perspective, to have running the office during the after 9 or 10 o'clock at night. But during the COVID, we did that not for the purpose of the financial gaining anything. We did it because we knew the emergency room and the hospitals are overwhelmed with COVID and other more serious issue. So we didn't want the emergency rooms in the hospital to be overburdened by odontogenic. Odontogenic means into odontogenic infections, which means the infections that caused by teeth. Because you correct, sometimes tooth infections, it can be serious, and sometimes it needs immediate attention to be taken care of it. Which again, if it's some serious things happen at 1 o'clock midnight, like sometimes, let's say, the dental infections can spread out and it cause the patient have even difficulty of breathing or swelling. If that happen at 1 o'clock at night, yes, they have to go to the emergency room in the hospital. But during the COVID, we were even open for those circumstances.
Can a toothache be... Hold on. Let me make sure I say this correctly. I don't want to say cured. Filling the cavity would take care of that. But could the pain be subsided by antibiotics and or steroids, at least temporarily, until they're able to get an appointment for a drilling?
It can be relieved, but unfortunately, the pain is not going to be relieved immediately. The only time that immediately you can relieve the pain from the infections, and when you drain the infections or you open up the tooth, you get the access to the canal of the tooth and release the pressure on the tooth. So antibiotic can help, but is not the definite treatment, nor they give an immediate relief. It takes time, basically, to antibiotic to start to kick out.
But what will bring the swelling down?
What bring basically a mechanical debridement. It bring the swelling down. That means we need to get access to the source of the infections and clean it up. So if it's on the soft tissue, then we have to make an incision, get access to the pus and infections and release it. If the source of infections is from decayed tooth, then we have to open up the tooth, get access to the canal, and release the pressure and infections.
Interesting. Okay. What do you think are some of the most common misconceptions that people have about dental procedures? We've talked in the past. I asked this question because we've talked in the past, I think it was a few weeks ago, about the fears that people have in life. People have a fear of dying. Well, that's because it's the unknown. No one's ever come back from the dead and said, hey, this is what happens. We don't know. We have faith. People are afraid of public speaking. I hear this all the time as a radio personality. Getting up on a stage in front of hundreds or thousands of people they've never met before. Yeah, it takes a little, it can be a little nerve-wracking even to a person who's used to speaking. But dental, you can't avoid death. You don't have to be a public speaker, but you have to have your teeth looked at. Everybody.
Correct.
And yet people are afraid. So what are some misconceptions that people have?
Two major misconceptions exist that I find through 25 years of practicing and see patients on a daily basis. One obviously big misconception is the pain. Patients, they feel that dental visit or dental procedure are painful, which that is absolutely wrong, because with the profound local anesthesia, we are able to block all the nerves. So basically the tooth and the gum and everything to be numb. So that misconception is one of the biggest misconceptions, which we try to educate our patients. We try to give them a better experiences than past. Part of it, dentistry medicine had been evolved. We have more or a stronger or more proficient anesthetic than before. One of them that came to the market probably not long ago, maybe 25 years ago, 20 years ago, it's called Septocaine. Septocaine or Artcaine is a type of anesthetic that is way more stronger than the conventional one, and patients that after we make them numb, still they have pain. Now we do have those Septocaine available, so we are able to basically block any sensation to the tooth and to the gum or surrounding tissue, so the patient would not feel pain. So besides that misconception of the pain, the other misconception that we are working at Columbia Dental on it is that they believe that a dental procedure is take many visits. But what we have done at our Manchester location at Columbia Implant Center, by consolidating all different resources, including the lab and digital laboratory, we are able to provide the services and deliver the product or the prosthesis at the same day. So that misconception is also, we trying to pass by that misconception. People, they have on their impression, they have to go prep the tooth for the crown, they have to be 2 weeks with the temporary crown, that temporary crown is going to fail out few times until
crack. Don't eat any nuts.
Yeah, don't eat any nuts or anything. Thankfully, unfortunately, by creation Columbia Implant Center after COVID, we trying to eliminate those misconceptions and inform the public that you don't need to wait too long. That it doesn't need multiple visits. Everything can be done at the same day.
Before you give Novocaine, what's that swab? And they put it in your inner cheek, and before they give you the.
Yes.
What is that?
Okay. The swab it's just numb the tissue, but it's not injection, so it really doesn't numb the tooth. Just it make the needle when you put the needle on the tissue, so the injection would be less painful.
Okay, I always wonder because there are different flavors to that.
That's correct.
Right. Okay.
That's correct. Yes.
So what? How do dental professionals? How do you guys stay updated in the latest technological treatments and all these technology treatments that you have?
But obviously, they are continuing education courses that, thanks to internet, we are now these days we are able to take a lot of those courses in online. We don't need, like older days. I remember I used to go to California, Florida. Yes, still it's good to go to those personal a meeting, but by now these days it become less and less popular, because in reality you can get the education that you needed. You can get it without wasting too much time on traveling and to be away from the office and so on. And internally we are cooperating with a company called Nobel Biocare. Nobel Biocare is the first company that manufacture dental implant. Dr. Brandmark, who invented the dental implant back in Sweden in 1965, he he founded a company called Nobel Biocare or Nobel Biopharm. And we, as a part of being their customer, they provide us continuing education courses, either in the office or where we go to other locations like Boston, New York. They do have a laboratory in the New Jersey. We can go there. We get training or whatever needed to be done. So that part of internal training that we have. But externally, of course, there are many other resources to elaborate.
Are cavities visual to dentists without taking an X-ray? Like, for example, let's say somebody walks in with a toothache. And you go, okay, sit down, you bring the light over, you look in. Is there anything, I know an X-ray will show everything, I get that. But absent of an X-ray, are there any indicators that a trained eye, such as you, such as a dentist, can see under powerful lights without an X-ray? Could you determine if there's a cavity there?
Correct. The conventional dental radiograph, only the decay has to be deep to the dentin. The outer layer of the tooth, it's called enamel. When the decay is in the outer layer of the tooth, it really doesn't show on the radiograph. So the only way that you can detect those small decay, we call it incipient caries. Those decay is by clinical observation. We are using an instrument called Explorer, and if we get a catch on the enamel of the tooth, that's an indication that there is a decay there. So 40 to 60% of the decay are not even detectable by radiograph and conventional radiograph. But you're right, sometimes a patient come and they have a lot of pain, and we take the x-ray, and then we do using Explorer, and we don't see the decay. Those are the cases that the tooth might have a fracture, and it's have a fracture that with the naked eye, we might not be able to detect those type of fracture. But at Columbia Implant Center, again, we do have a CT scan. That those cases we can take a three-dimensional radiograph, and many times we can detect those fracture on the tooth and make a proper diagnosis.
Well, I would think that a fracture is more visible. You can see the crack.
Sometimes
Like a hairline crack.
Hairline fracture, but those hairline fracture is very difficult to be diagnosed because you cannot see. I mean, we use loop that it magnified 4 to 6 times. We do have a microscope that it magnified up to 16 times. Sometimes we cannot see those fractures. So, or is it deeper? So that's why CT scan or three-dimensional radiograph, it could be helpful. Not always, even there are times that even cannot be detected by CT scan, but we do have all the diagnostic tools to that make that determination.
Folks, you are listening to the Columbia Dental Radio Show along with Dr. Mohammadi. I'm Gary Byron. Write this phone number down. Ready? 860-645-0111. All right, I'll repeat it. 860-645-0111. And you know what? I would say put that in a place, maybe on a magnet on your refrigerator. By your bedside. I'll tell you, emergencies are just that. They're always unforeseen. And you know what else happens? Not only the unforeseen, when they do occur, it's usually at the most inopportune time. Oh my goodness, as if I didn't have enough going on in my life right now. Now I've got to deal with this. But when you have that number handy, knowing that, well, Columbia Dental and Implant Center, they're open 7 days a week, you'll have this, I would say the comfort and convenience of knowing that they're right there for you. Doc, what would you say are any unusual or perhaps even unexpected health conditions that can be detected through, let's say, a simple dental exam? Are you able to detect other health issues?
Absolutely. Is one of, let me give you an example of a patient and that's happened real life. So a patient come on Sunday and broke the front tooth. The broke front tooth, or that tooth was not savable. We wanted to, from dental point of view, the tooth needed to be extracted and place the implant. But as a part of our routine examination, we took a panoramic X-ray. So when we took the panoramic X-ray, we detected that a patient has a very unusual pattern in the radiograph on a lower right, lower jaw. We call it mandibular. And from the pattern, there is some type of very nasty carcinoma or cancer. We call it amyloblastoma. From the pattern of the radiograph, we suspected that patient does have that disease. And so obviously we deter placing the implant, and we refer the patient for further biopsy and examination. And unfortunately, the patient ended up to have that amyloblastoma. So, and didn't know about it. So imagine the patient come just for receiving another dental treatment. It just knocked out the tooth, perhaps in the fight or in the bar or something like that. I don't recall that. Knocked out the front tooth, and then the next day we find out that the patient has even more serious condition than the front tooth. So yes, there is oral carcinoma. It can be detected by clinical examination, and also by taking routine radiogram, or we call it panoramic X-ray, that it goes around our jaw and it shows all the infrastructure or the bone and the tissue.
Are there any surprising dental procedures that maybe you perform that most patients aren't even aware exist?
The surprising dental procedure, yes, we do quite a bit of them. Like we removing tissue using laser, they're not aware of it. We using microscope during the endodontic procedure, they're not aware of it. There are a lot of technological aspects that we use. We use digital impression. Patients still, they are used to put all those stuff in their mouth and take the impression, but these days we don't use those. We just take a picture. It's just, we take a selfie or something from the tooth, and everything is digitalized. So those are stuff that I see on a daily basis, that many of our patients are not aware, because the technology has been evolved so fast during the last couple of days, and we try to be on the top of it as well to implement to our practice.
Is there anything that you yourself, what's the right way to ask this? If you had a specialty, something that, man, this is where you're shine, this is right in your wheelhouse. I know you can, listen, you're Columbia Dental and Implant Center, you guys can do it all. And I remember learning this years ago from you, where it's like one-stop shopping. Well, this is one-stop dental, orthodontist, periodontist, right? Implants, cavities, root canals. You do it all. You even have the laboratory to not just provide a temporary, but you can do the crown right there. So I know all that. People who listen to this show are aware of that. But there's got to be one area where, when I was in college, I knew, or dental school, I knew this was going to be my area of expertise. For you, what would that be?
My area expertise is basically is what I do, and it's called oral medicine. So that means a diagnosis, and that's why basically right now, the only thing I do diagnosis. On my younger days, actually, I used to do a lot of procedure. I used to do extraction, I used to do restorative, even prosthodontics, and dentures, crown, and you name it. I've done all of it. But the area that I really always been fascinated, and there is the oral medicine. Obviously, there is no specialty that it called, I do oral medicine, or we call it stomatology, the name of it. So there is not really, let's say, established specialties that somebody goes and like to become, let's say, like to become oral surgeon, like there is like a 3 years training to become a stomatologist. There is not such a thing, but in a school there are a department that is called Department of Oral Medicine and Stomatology. So any dental school that you go, there is a department that they are specialized in diagnosis, and that's what basically I do. When I see patients, I am a triaging doctor. I'm a doctor that make the diagnosis, proper diagnosis, like we talked, at the beginning of the show about the fracture, about using, do all differential diagnoses, or I see something suspicious in the soft tissue or in a radiogram. And then I refer it to the proper specialist to perform the procedure.
One final question. I've only got about maybe 2 minutes or so. I wanted to ask you about how dental health how does it impact your overall health in ways that maybe people listening to this would actually be surprised?
Oh yeah, dental. There is a link between between the many disease in oral cavity and the systemic disease. One
Oh.
of the most important one is a cardiovascular disease or heart disease. In recent study, they find a same bacteria that it caused the periodontal disease. We call it Porphyromonas gingivalis. They find that on the patients that also they have endocarditis. So those link between the heart infections and the periodontal or the gum infections been the subject of the recent studies and recent research, and it shows there is a correlation between the disease. There is many other studies shows correlation between diabetic, respiratory, and so on. Of course, it's a part of the body. Bacteria can travel. There is no, wall between them. Okay, is like a open border. Okay, bacteria, it does not, you cannot make a wall between different organ of your body, and make Mexico to pay for it. So there is not such a thing. So, bacteria, they travel. Okay, travel from one part of the body to the other part of the body is the open border, and the only way to fight it is need to have a eliminate the bacteria in any part of your body and organ.
Folks, if you'd like to attend a webinar on the basics of dental insurance to help your choice for renewal this year, please email Corpadmin, CORPADMIN, corpadmin at columbiadental.com, and then they'll send you an invite. I believe it's on October 8th, and it's at 12 noon. Again, it's corpadmin at columbiadental.com. The phone number for Columbia Dental is very easy. It's 860-645-0111. Again, that's 860-645-0111. For Dr. Mohammadi, I'm Gary Byron. Thank you so much for listening to the Columbia Dental Radio Show. Until next Saturday morning, have a good one, everybody. So long.